there. This is your CT Style Express, and I'm Teresa Dufour. While CT Style remains on hiatus, we continue to showcase businesses around the state that are ready to serve. Today from Fairhaven Community Healthcare, we have Chief Medical Officer Dr. Benjamin Oldfield joining us via Zoom. Hi, Doctor.
Hi, Teresa. Great to be here.
Yeah, thanks for chatting with us. So first, before we get into it, Fairhaven Community Healthcare, give us the mission behind it.
Yeah, sure. So we're a community health center. We are based in Fairhaven, although we have sites really throughout the area, and we also provide care at some of the school-based health centers at area schools. Our mission is to provide culturally responsive care that is comprehensive, so from birth through to geriatrics, for everybody, regardless of their abilities to pay.
Sure. So one-stop shopping, all in one spot.
Exactly. That's the idea.
All right, so we're talking about staying healthy during the pandemic, these current times. And the first step would be to get tested. So talk to our viewers about the importance of getting a COVID-19 test.
Yeah, I'm glad you asked, because I think that's really one of the most important things that we can do to help turn the needle on this epidemic. Without testing knowledge, we don't know where to direct our resources from a public health perspective, but we also don't know who should quarantine and who should remain isolated from others. So testing is just so important for many different populations. For some populations, for example, let's say people who work in a nursing home or people who are about to have a surgical procedure, they may benefit from just getting tested across the board so that they can inform sort of where the nursing home bed should be or whether or not the procedure, if it's an elective procedure, should be delayed until the infection has gone away. But then absolutely, if anybody has symptoms, they should also be tested because we're actually entering the time when there's going to be more and more respiratory infections. The flu season is just around the corner, and it's going to be really helpful for us to be able to test, know who has COVID and who doesn't, because that can inform decision-making around who should stay away from other people.
Yeah, that makes sense. And what is the current availability for tests?
Yeah, good question. For us, in New Haven, there's a few different options to get tested. Various different health centers, hospitals are offering testing. So I would say that for most people in this area, if you want to get tested, you can probably make a phone call and get tested within the next 24 to 48 hours. So we have pretty good availability of testing here. I would also say that, particularly here at Fairhaven, we're making special efforts to do outreach for testing in places where there are people who may have, barriers to get their health care. They may be homeless, they may be elderly and have difficulty with mobility, with transportation. And so we're trying to be sort of proactive about going and doing pop-up testing in sites like that, where we can actually help meet people's needs really where they are.
Sure. And speaking of being proactive, people talk about the 3 W's. Can you run us through that?
Yeah, thank you. So first of all, it is wear a mask. And we can talk a little bit more about what that looks like and how to do that correctly. Second of all, it's wash your hands. There is nothing more important really for most kinds of infection control than hand hygiene. And so, lots of people are talking about all this exciting stuff around treatment and vaccines and all that stuff. Really, it's sort of the boring things like hand washing that are really the most important things. So I can't stress that enough. And then the third W is we say, watch your distance. And so this is getting at that idea of social distancing, or I actually like to call it physical distancing instead of social distancing, because you can still be social at a distance. But the idea is that as long as you can really have 6 feet between you and another individual, that drastically reduces the spread of coronavirus.
Sure. And Doc, let's talk about masks, because we know that children are going to be wearing them to school if that goes forward this fall. What is the correct way to kind of put one on and then take one off?
So masks come in lots of shapes and sizes. And I think it's important to know that a lot of different kinds work just fine. So, the way that the coronavirus is transmitted is from these things that we call respiratory droplets. So those are those little things that are so small you can't see them, but when you sing or talk loudly or sneeze or cough, you kind of create a little cloud of these things in front of you. So the whole idea from a mask is just to create a barrier so these things can't be shared with other people. So to that end, really just a cloth mask is fine. So something that has 2-ply, that covers up your nose and your mouth, so that's important, and would help sort of restrict these sorts of particles from leaving your mouth. So for example, and again, there's a lot of different models. I've got an example right here. This is a cloth mask that someone gave me. And the way to put it on, I think, is actually worth thinking through. So you don't want to touch it as much as, you want to touch it as little as possible. And you want to know which side is sort of the side that faces your mouth and which side is the side that's going to face the environment. So what I tend to do is I start by putting it over my nose. Then I have the ear loops go around my ear. and then just make sure that the bottom is nicely covering my chin. What you want to avoid is for this to just be covering just your mouth or just your nose. So this is not effective. That's not effective. And then likewise, just the nose, also not effective. When sometimes people ask about how to store the mask. So again, you want to take it off by touching it as little as possible. Take off the ear loops like this. And then in general, I like to have a bag to put it in. So a plastic bag, a Ziploc bag, that then it can be ready for use after you wash it again.
Very good. All right, these are all very important things. And of course, a healthy lifestyle goes along with all of this.
Yeah, exactly. So, you know, I think remembering the other parts of your health is so important here, because when we've noticed that, you know, when we look at, so who has poorer outcomes from coronavirus if they happen to get it? And it's people who have, let's say, you know, they're elderly and they may have uncontrolled chronic medical problems. So I think this time is a really good reminder to pay attention to those things. Right. So if you have, let's say, diabetes or lung disease, pay attention to taking your medicines and stay in touch with your providers and stay up to date with your screening exams. All those things are so important to help keep a strong, healthy immune system and be able to combat the coronavirus if you happen to get it. Right. Other things are just sort of, you know, the things that your grandma probably told you growing up to do to stay healthy. So try to keep a regular sleep schedule. Try to stay hydrated. Do something active every day. You know, being outside is a fine place to be. There's less transmission outside because all the air is circulating so much better. Sure. And then the last thing I'll just put a plug in as far as getting your flu shot. Again, I mentioned we're sort of entering the flu season in a couple months. Really starts around kind of the beginning of September. But, you know, being vaccinated against other respiratory infections can help you protect yourself against coronavirus if you are unlucky enough to potentially get both.
Sure. All right, Doctor. Thank you so much for all the information. And you could learn more at fnchc.org. That's Fairhaven Community Healthcare. We really appreciate it, Doc. Good stuff.
Thanks so much.
Sure.